your session chair. And my name is Vince Chipatuka from the Friedrich Ebert Stiftung Lusaka office. Probably we could start the ball rolling. Sorry for starting the meeting late, and once again, apologies for starting the meeting late. So we have 4 poster presentations. The first one is coming from Ms. Bonolo Matiba from Botswana. Then we'll also make those presentations in the following manner. So we'll start with Ms. Bonolo Matiba from Botswana. Should be making a presentation on a beneficiary engagement in designing social protection programs. Is it a design or default? Then the second poster presentation will be from Ms. Alice Pierce from Zambia. The poster is on gendering the impacts of COVID-19, equitable policy response for Zambia. The third poster presentation will be from Mr. Martin Tarusenga from Zimbabwe, which is talking to enablers as the foundation of sustainable social protection instrument, lessons from Zimbabwe. And last but not the least will be a poster presentation from Mr. Simekinala Kaluzi from Malawi. And it is talking about assessing the role of civil society in championing social protection during the COVID pandemic. So with that remark, allow me to call upon Ms. Bonolo Matiba from Botswana to make the poster presentation. Thank you.
Hello, can I just ask, have we got an option not to switch on the audio?
Is made by UNDP Botswana with Boga Bizani, and who will take over and make the presentation. Please project. Thank you.
Yeah, and sorry, may I also mention that you have 7 minutes to make the presentation. Yeah.
I should make the presentation from here. I hope you can see. It's not as visible as we had hoped. This is the pointer. Okay. Ooh. So just when I thought I was in charge, something happened. Can you get it back to the first slide? But the background is that just like all the other presentations that were made, Botswana did have an experience with COVID-19 that pointed towards loopholes within the social protection system. And that called for a review of the social protection programs to say, since we have now seen that the existing program could not cope with the challenges posed by COVID-19, what can we do? We saw overnight people, households with no income because of the lockdowns. People were no longer able to go out and hustle for themselves. And all of a sudden, government had a huge burden to support households. But obviously, that was not going to be sustainable. And therefore, to sort of correct that with an eye to the future, what do we do? That is how the government of Botswana, in partnership with UNDP and other partners, decided that we are going to go for an overhaul of the social protection system. We are going to because you see, you realize that if you could go to the first slide, in fact, that should be the second, I think. Again, yeah. If you look at that slide, you realize that a lot of those programs were developed at the beginning of that timeline. That is 1966, when Botswana gained independence. So a lot of the social protection programs were developed in the early years of independence. And if you look at that, the last 20 years, really, nothing has been developed in social protection. And therefore, these programs were aging, and their ability to cope with shocks like COVID-19 was compromised. And that is why this overhaul was justified. And that is when a decision was made to adopt the life course approach. The life course approach, obviously appreciating, and let's go to the next slide, appreciating the different stages of human life, from birth to death. You go through the different, let's go to the next slide, we'll come back to this one. Investing in health and nutrition from the early days, pregnant women and children, and then investing in education. That's the next slide, the next stage, and skills development, supporting decent work and income generation, and in later life now, providing dignity and income security. That is the approach now, to say we need a social protection system that is responsive to those stages, and hence the life course approach that we are talking about. But if we go back to the second slide, just to get an overview, is that the second one? Next. Yes. We wanted to share some of the findings from this review that we undertook, and this is how I actually came into the picture to work with UNDP as a private consultant to carry out a review of the social protection programs in Botswana, all the 29 of them across the 9 different ministries where they are found. So this was a massive assignment. And one of the findings here was from this review was that we are lacking in terms of monitoring and evaluation. Our programs are not well monitored. They are not well evaluated. And therefore, we're not able to make statements about their performance. You know from monitoring that you are able to say, are we on target? If at all you have targets, because targets also depend on whether you have robust monitoring and evaluation frameworks where you specify where you are going and how you're going to do it. Should we proceed? Okay. All right. So now,
is this technology, this sheet of technology?
should we continue? Looks like we are overlapping somewhere, but that is the monitoring and evaluation part that allows you to be able to continually assess whether you are moving towards your set targets, and if not, to be able to make adjustments to the path that you set. Evaluation, which is normally confused with monitoring, at regular intervals, you would want to look back and say, for all that I've done, am I moving towards the larger goal? What is the whole purpose of social protection? Is it to improve the livelihoods of the citizens? Yes, it is. What indicators have we set for that? Are we moving towards that? In fact, yes or not? But you will be investing money into those measurements. That is not done. We also came up with the finding that for a lot of these programs, it requires skills development. It requires capacity building for the beneficiaries, for them to be able to optimize the opportunity offered by social protection programs. But we are not investing a lot in developing the capacities of the beneficiaries. And at the end of the day, the benefit of social protection programs was not optimized because the beneficiaries were more of recipients and not really meaningfully participating in shaping their own destinies. Now, this is something that needs to be looked at. This is something that requires us to then say beneficiaries are not just people sitting there to receive social protection services. Beneficiaries should be viewed more as partners in social protection, build their capacities so that then they can be able to stand alone and graduate as quickly as possible. That was another big finding. I'm trying to, let me just get close to this because I can't find my glasses. Yeah, it works. But from all the findings that we have listed there, those are the two key findings. Strengthen M&E, capacity building, but with capacity building, you have to actually identify the capacity needs for you to be able to address them. If you're going to invest in cash transfers, for example, you need capacities in financial management. There is no point giving people some money that they cannot even account for. When you come to assess the impact, it is going to be very difficult for you to even get the information that you can use meaningfully to make statements on the impact of that particular investment. If people are going to be doing projects, income generating projects, they need skills in market research. What kind of projects would make a difference? Where should they channel their efforts? Where are they likely to succeed? Which projects have failed before and therefore they should not make their time? And by conclusion, marketing skills, taking the products to the market, because we have income generating programs as a key component of our social protection program. So at the end of the day, once people have produced whatever it is that they produce, where are they going to sell them? There is an expectation in Botswana that once we produce, government should come and buy. Is that sustainable? It is not. We need capacities in marketing. Thank you, Chair. We can discuss a lot of other things, but those are the highlights. Thank you.
Thank you very much. I wish.
Thank you, Chair. Good morning, colleagues. So I'll be sharing on the gendered impacts of COVID-19. Then I'll also share some of the strategies for gender-sensitive policy responses in times of crisis, particularly during the COVID-19 pandemic. So what we know is that pandemics have differential impacts in society, and the experiences of women and girls vary significantly because of their socio-economic positionalities. COVID-19 has the potential to increase negative social vices such as intimate partner violence, stigma, discrimination, as well as unequal access to information and social protection. This also impacts their access to sexual reproductive health services. So what we know as well is that impacts of a crisis are never gender neutral, and COVID-19 is no exception. That's why findings or evidence actually suggests that global and national strategic plans for COVID-19 preparedness and responses must be backed by a strong gender analysis, as well as ensuring meaningful participation of affected groups, especially women and girls, in the design, decision-making process, as well as the implementation of social protection programs. So to highlight some of the gendered impacts, the first one is an increase in women's double burden. So traditional gender roles actually prescribe that women are largely responsible for the education and childcare of children, even when both parents are available for this task. So when COVID-19 led to the closure of schools, women actually had to take up the task of facilitating learning from home, regardless of their work status. So division of labor in the home was still very gendered, even if fathers had flexible working conditions or flexible working schedules. But you'd find that the double burden of women actually increased. Gender differences in housework and childcare responses to the pandemic were particularly acute among employed parents. That's because it created additional responsibilities for mothers, especially employed or working mothers. This was also seen whether women were in the formal or informal sector. Another impact was that of the increase on gender-based violence. So COVID-19 actually played a significant role in perpetuating existing inequalities and vulnerabilities. That's because it worsened the economic and social stress, coupled with restricted movements as well as social isolation measures. Gender-based violence was also reported to be on the increase. I have some statistics to share. Statistics indicate that gender-based violence cases in the third quarter of 2020 actually increased by 19.8%. That's from 6,788 cases in 2019 to 7,640 cases in 2020. Some of the issues that were highlighted were that the time spent at home, as well as frustrations from the loss of income, led to increased cases of GBV and resulted in heightened tension in the household. We also saw that the separation of children from caregivers due to quarantine, hospitalization, or even death increased children's vulnerability to physical and sexual violence, neglect, psychosocial stress, and complete loss of household income, which was resulting from the loss of a caregiver. Victims of gender-based violence were also hesitant to report cases. That was because there was a misinterpretation of some of the COVID-19 preventative measures, such as the stay-at-home campaigns. We also noticed that there was a breakdown in service provisions that limited the access to sexual reproductive health information and services, as well as psychosocial support for victims of violence, since healthcare service providers were actually overwhelmed with handling COVID-19 cases. This also resulted in another impact that's on teenage pregnancy and school dropout rates. Those had actually increased because by the time kids were going back to school, some of them had fallen pregnant or some of them had completely lost interest in education, as well as there were quite a number of negative coping mechanisms because of the impact of the pandemic on their livelihoods. So for example, some children may have engaged in transactional sex or sexual exploitation. There was also an increase in child marriage, which is an imminent threat and could actually worsen the HIV prevalence rates. Also, the concentration of COVID-19 resulted in limited access to sexual reproductive health services, as I highlighted earlier. Another impact was that of an increase in poverty and the loss of livelihoods. So women are already in situations of poverty and high vulnerability to social exclusion. And you find that those ones that are highly susceptible to social exclusion actually bore the worst brand of COVID-19 impacts. This particularly impacted the elderly, persons with disabilities, and children. And many women and members of vulnerable groups actually work in the informal sector, where they have limited opportunities and access to social security and already live in poverty. They also have no savings or access to financial services, which results in a significant risk in their social and economic mechanisms to cope with shocks. Estimates suggest that the informal sector actually employs about 87.5% of workers. Many of these are women who work as domestic workers, street vendors, or daily laborers who actually depend on hand-to-mouth for their livelihood. So a disruption in the economic activities, you would find that this impacted their survival and the quality of life for women and vulnerable groups. COVID-19 also exposes women's precarious economic position and security, particularly in the sectors that are considered feminine, such as the care and hospitality sectors, which were heavily impacted by COVID-19. So the economic impacts are also likely to have long-term effects of the livelihoods of women and vulnerable groups, especially those that are working in the informal sector. This also meant that there was a reduced household income, meaning families had to scale back on essentials such as nutritious meals. There were also temporary interventions. This was shared as well. This was shared as well by some of my colleagues yesterday, where they highlighted the emergency social cash transfer, where households were being given 400 kwacha monthly, as well as some food supplies for at least 6 months. But then this was just a temporary intervention targeting 22 districts and 204,000 beneficiaries. So finally, I'll share on the strategies for gender-sensitive policy responses during a time of crisis. So we need to consider how various inequalities actually converge during times of crisis, resulting in gender-differentiated impacts, particularly for marginalized groups in society who tend to face intersecting and multiple forms of discrimination. Therefore, we need to prioritize the collection of accurate and disaggregate data. That's by gender, by age, location, as well as the status of vulnerability, in order to design programs that are responsive to the needs of different populations during times of crisis such as COVID-19, as well as ensure the response to COVID-19 does not reproduce or perpetuate harmful gender norms and discriminatory practices or inequalities that already exist in society, even without the crisis. We need to ensure that policies and interventions are deliberately targeting women and girls in order to design gender-sensitive or gender-responsive social protection programs, as well as strengthen the efficiency of social protection responses in crisis. This should be done in a timely and predictable manner, and this can be done by constantly addressing the challenges in the implementation of existing social protection programs even before a crisis occurs. There also has to be a way to increase the buying power of social cash transfers in order to effectively mitigate shocks to vulnerable communities. That's by incorporating inflationary price index in the design of social protection programs, because sometimes you find that the amounts that these households get are actually not enough to adequately address their needs because the cost of living could have gone up. So we also need to ensure that policies and interventions are responsive to everyone's needs, while at the same time prioritizing those of women and girls, and prioritize women's participation and incorporate their voices, as women play significant roles in their communities, and this typically places them in a good position to influence the design and implementation of social protection programs and policy interventions. And finally, we need to support meaningful engagement of women and girls at community level to ensure efforts and responses are not further discriminating and excluding, especially during a time of risk. Thank you.
Thank you very much. Thank you very much, Alice, for the presentation and also for the many issues you have brought up which need to be done, especially in the area of ensuring that we bring up to speed the women who get disadvantaged in many spheres of life. So very quickly, we'll go to Martin. Martin, are you able to hear us?
Yes, I can hear you loud and clear.
You could unmute, Martin.
Can you hear me? Hello?
Good morning, Martin.
Morning. Yes, I can hear you. Can I start?
Good morning, Martin.
Morning.
We can't hear you. Could you wave
Okay.
if you are hearing us?
Hang on.
He has muted himself, maybe. Could He's out. Okay, Martin, we'll get back to you. Can we get to... Huh? He's not there. Okay, so then we can go to the last presentation. Simekinala Kaluzi. Okay. So, so colleagues who are here, okay, good. Simekinala, you are here. Are you able to hear us? Good morning, Mr. Kaluzi. Good morning, Mr. Kaluzi. Good morning, Mr. Kaluzi. I don't think we will succeed. With those who are here, I don't know if there are participants online. Do we have participants online? For those who are here, please, if you have any questions to the first presentation which was made from Botswana on the beneficiary engagement in designing social protection programs, do we have any questions? And also questions to Alice Pierce on gender impact.
Sure, I can go first.
Okay, thank you very much.
All right, thank you. Thank you so much for the presentation. I think the two that we've heard from have been quite elaborate. Mine is just firstly from UNDP Botswana. I think it's an interesting approach in terms of trying to include the beneficiaries in the design of the program. This is something that I think even at our stage in Zambia, we don't really do. But I was interested in, first of all, how you could give us a bit of understanding on how you identify the beneficiaries, because that seems to have been a challenge even for our social protection programs. I don't know if you're able to give us some insights on how you do that. So firstly, you're getting to including them in the participation, but how do you identify them before you get to that stage? Thank you.
Thanks. You could respond.
Yes, thank you, sir. Maybe I could approach it from two different perspectives. The first one being, how did we engage with them? How did we get to have a conversation with them? Because that also was a process. It was more like some methodology involved in identifying the beneficiaries. This is where you work with the program itself. And they have records and they can tell you where the beneficiaries are located and actually assist you to arrange those focus group discussions where you're going to meet the beneficiaries and have a conversation with them at an appointed time and venue. So that was not a problem. But I also understand your question to say the actual identification or selection of beneficiaries for programs. And that one is not straightforward. Firstly, it depends on which program this is. If you look at conventional social assistance kind of programs, This is where you depend on the social system, the community, the community leadership, the health service providers who identify the needy and actually bring it to the attention of the authorities, and a proper social assessment is carried out. And based on that social assessment, a decision is made to say, yes, this particular individual qualifies for inclusion or not, because it's a very methodic, at least on paper, methodic approach to selection. However, as you would imagine, there are different types of social protection, at least in the current scheme of things. If you look at cash transfers, for example, where people, have to be assessed for whether or not they qualify based on their social status, the kind of wealth status. There is a bit of bias. If you go into the selection or the criteria that is used to select beneficiaries, it becomes a bit blurry. There would be like, you have to have 2 cows or 3 goats, or you have this, you have that. And it's not really easy to implement. And even as you discuss with program staff, they will tell you, look, you get to a point where you just have to make a decision because the guidelines are not very helpful. So if you ask me, we get to that point where we really need to have a conversation on selection criteria. Make it practical and make it easy, because at the same time, you are not always going to have qualified people using that particular tool. For example, there are cases where a tool that is designed to be used by social workers ends up being used by extension people in agriculture, because they happen to be selecting beneficiaries for an agricultural scheme. But then they don't really understand the selection criteria themselves, because they were not part of its development. So that it introduces a lot of subjectivity in that particular case. And therefore, that is why I'm saying we need that conversation.
Sorry, I thought I'm only speaking to this room. So we are ending at 10. So could you please make a follow-up question and also deliver the question to Alice? Then please be brief in your responses. Unfortunately, Martin, we cannot get back to you.
I can hear you now.
Thank you very much. So Secretariat is communicating to you. We don't have time because the other group in the main hall are waiting for us. So apologies. Please, we shall share your poster presentation with the rest of the participants, and we greatly appreciate your efforts, sir.
Hello, but I can hear you now. Can I present quickly? Hello? Hello?
We are sorry, Secretariat is in the process of communicating to you. Yeah.
Okay.
Okay. Thank you.
All right.
So just quickly, I think thank you for that response. Selection criteria is a bit of a challenge. We've also had challenges with it. In Zambia, we sort of use a mixed approach where you do the survey, go around, check assets. So you enumerate more or less to understand the assets. Yeah, you have a means test, and then there's also a community validation where those that are missed out, community members will come through and just tell you, look, we know this elderly person here, but some of the issues you're raising are quite important where you're picking between poor and poor. So really there's a very little difference between those households. So I guess that's an important conversation. But then bringing into the participation and the selection criteria, sort of the issues that Alice, you raised around the gendered impact. Does that mean we then need to consider designing social protection programs with a gendered approach? Currently, some of the programs that we implemented, I think even the emergency cash transfer, didn't really have a gender approach. Of course, the program will obviously prioritize female-headed households, but in terms of taking into account some of those differences at household level, that's not really done in the program. We basically just identify households and we give out the monies. But given what you sort of highlighted in your presentation, should we then be thinking around changing the way we design those social protection programs?
Yeah, any response? If there is none, we could go straight to...
Let's go straight to Alison.
Yeah.
I'd want to add after she said what she...
Good.
Okay, all right. Thank you for the question. Yes, indeed, many of our social protection programs are actually very gender neutral. I don't know, maybe it's because we lack gender disaggregated data, or even just disaggregated data for that matter, because it's not just about gender inclusion, but also inclusion across all spectrums. For example, disability status as well. We need to mainstream that. We need to mainstream gender. So in as much as we develop these programs with the idea in the back of our minds that we are targeting women, we're targeting persons with disabilities, we're targeting the elderly, but to a certain extent, the programs are not as equitable as they're supposed to, because these groups of categories actually have very specific needs that are very different from people. For example, women, you may have a woman who's disabled and just a woman who's vulnerable. So their needs are very different from each other. Maybe that's why also when they develop some of those social cash transfer programs, you find that people with disabilities get more than just a vulnerable woman. So maybe those are some of the things that we constantly have to keep looking out for and make them better so that they're more responsive towards the different needs that people actually have.
Just to add that we had a program called Women Economic Empowerment Program, WEEP, under the Gender Affairs Department in Botswana. And we do have a comprehensive review if you want to perhaps look at that, just to expand, the literature that you're looking at. Thank you.
Thank you very much, colleagues, for those two presentations. Very importantly, participation of beneficiaries in the designing of social protection programs, very critical, and also gender transformation. Let us transform, let us gender inclusion and the like, very important towards programming of social protection. Thank you for your poster presentations, and also the participants. Thank you very much for coming to this session, and apologies once again to Martin and Kaluzi for not connecting to you. I don't know if you are present, but rest assured your work is most appreciated.
I am present.
And will be shared with the rest of the participants. So we've come to the close of this session, and I'd like to ask that we go and join the other group in the other room. Thank you very much.